what I know briefly from Dr. Smith is that you are seeing him for evaluation of lipedema that you've been diagnosed for in your right leg.
Well,
is that correct?
I have never really been diagnosed.
Okay.
But
by him, he's given you a diagnosis of lipedema. Okay. And when was the first time you saw Dr. Smith?
I forget the date. It was about 2 weeks ago. Approximately 2 weeks ago.
Have you had any pregnancies, by the way?
Yes.
Okay.
I had
How many?
three and one miscarriage.
3 pregnancies. Okay.
Yeah.
And 1 miscarriage. Okay. So tell me the story about what brought you to Dr. Smith and then subsequently to me.
What brought me to, I've been to several vascular doctors and I have been diagnosed with a venous insufficiency, but no real, I guess I wasn't willing to I didn't want leg stripping. I was afraid to let anybody touch my legs, but now I have a lot of pain in it and I'm willing to see what if something could be done.
The right leg that's bothering you.
Right worse than the left,
Right,
but you can see both of my legs look bad. The
and
right was
when did
worse.
you first start noticing
Years ago.
swelling in the leg?
Probably about 10 years ago.
10 years
swelling.
ago.
Yeah.
Okay. The issue, and I see a lot of patients with swelling in the legs, with venous reflux disease and varicose veins, and who also have confounding other issues like lipedema and lymphedema, and they present somewhat differently than venous reflux.
Right.
A lot of that is in the physical exam presentation, actually, in terms of the type of swelling we see, whether or not the feet and toes are involved. In venous swelling, we don't usually see involvement of the feet.
Right.
In lipedema, neither do we usually see involvement of the feet. In lymphedema, we do.
Right.
So when the dorsum, the backside of the foot and the toes are involved, that's more suggestive of lymphedema.
Right.
Patients can have venous edema and other problems going on. So when I see patients who have venous reflux and varicose veins and swelling and symptoms of venous reflux, in addition to their other problems, it's very important to understand that addressing the venous reflux will not be fixing the other issues per se. When Bridget did your ultrasound on just your right leg, correct? And I spoke with her about the result. She did see venous reflux in the vessel that comes from here in the groin and moves out more in the lateral leg. So that's the anterolateral vein, and that's a vein that we all have. It's normal anatomy, but when you have reflux down it, it'll become enlarged. And by reflux, I mean blood moving in the wrong direction. So the venous system is supposed to help drain blood out of the leg. And when that system no longer functions normally, we see backward flow of blood. Possibly, and every patient's different, symptoms like swelling, heaviness, fatigue, aching, cramping, heat, restlessness.
All the above.
And in a worst case scenario, some venous patients will end up with very severe skin changes and even open ulcers. So that's sort of an end stage progression. And you don't necessarily progress to that severe level. And undoubtedly your venous disease has been present for a long time, which is why you've noticed varicose veins for a long time. So probably dating back to your pregnancies a long time ago. So addressing the reflux here, fixing the reflux here, will address this component of the reflux and swelling. It's not going to have a significant impact on the lower leg. No, in terms of swelling. You may notice some good symptom improvement. It's not going to make all the spider veins go away.
Oh, that I know.
Okay, so to address the smaller vessels, we do things like sclerotherapy. To address these bigger branch veins, I fix the main reflux with a laser ablation procedure, and that involves putting a very thin laser fiber in the refluxing trunk vein with a local anesthesia around it. The heat from the laser is going to close that main vessel so that we won't have blood refluxing down it anymore. That's a very straightforward, easy procedure. I do it in about 15 minutes, local anesthetic, you're wide awake, put you in a stocking, support stocking at the end, and you walk out the door. this branch vessel will get somewhat smaller by closing the main vein that's refluxing.
Okay.
It will not go away completely.
Yeah.
And depending on how small it does get, we can then remove it through a few small incisions.
That's stripping? Is it the stripping?
It's not, stripping is the procedure that we used to do years
I
back.
wasn't interested in
Before
that.
laser ablation, before any of the thermal ablation techniques,
Right.
that
That's
involved.
why I never did anything.
Well, that was a major procedure. We'd go to the
Yes,
operating room,
yeah.
put people under general
Yes.
anesthesia, make incisions, and actually strip,
Right.
remove the whole vessel.
Yeah.
You don't need that done. And fortunately now we have techniques where we can
Yeah.
avoid that. But I would offer you laser ablation and a microphlebectomy or a stab phlebectomy. Whether or not you want to do sclerotherapy, that's more of a cosmetic
Right.
issue, but certainly something that can
Yeah.
be done.
How about this vein? This one is the one that really hurts me a lot.
All of these superficial vessels can
That's
be
superficial?
treated.
That's
Superficial
that one?
meaning close up to the surface.
Yeah,
So
oh, okay,
yes,
gotcha.
we can
Yeah.
see them. They're up close. They're not deep in the body.
Okay, but this one is a more deep.
This one is a superficial vessel as well. That's
Yeah.
why we can see it. It's
Right.
just bigger caliber.
Right.
So it's one of the vessels that'll fill with blood and bulge out. All of these can be addressed. The techniques that are used to address them vary based on their size.
Okay.
And in this case, this main trunk vessel needs to be laser closed because that's the one that has reflux.
Okay.
Okay? So the thermal ablation, the laser ablation treats the main trunk vessel reflux. The microphlebectomy and the sclerotherapy address the remaining branch vessels.
Okay.
Okay? And that's certainly something that can be offered to you.
Okay.
Understanding that it's not going to change the
Oh, yeah.
lipedema issue
Oh,
that
I
you're
know
dealing
that.
with.
Absolutely, I know that.
So when you come into the office, I have you stand because that
Okay.
causes them to fill with blood.
Right.
And then I mark everything that's bulging with a marking pen.
Okay.
So that when I lay you back down on the table, I know where
Yeah.
I'm working. Because as you
Okay.
know, the blood
Changes.
drains out of them and all of a sudden they flatten.
So this would give
That's
me
it.
a little relief, like in pain, like a
It
little bit, you
would,
think?
I would expect it to give you some relief
Okay.
because we're addressing the venous component of
Yeah.
your overall situation, but not complete relief.
Oh yeah, no, I know.
Because a
I know
lot
I'm
of-
not gonna have gorgeous.
Right. Well,
after this.
a lot of what you're dealing with
Yes.
is from lipedema, not from
Right.
venous reflux.
Hmm,
And the
really?
venous reflux, in the overall picture, I suspect, is a minor component.
Oh,
of the
okay.
issue.
Oh, really? Okay.
But it's every patient's different, and there's no
Yeah.
way to quantitate exactly.
Okay. Is sclerotherapy covered under insurance or no?
Live-
It's cosmetic?
In a patient with documented reflux disease like you have,
Yeah.
we can almost always get the sclerotherapy
Okay.
authorized.
Yeah.
It's a process.
Mm-hmm.
It can take time to see the results of sclerotherapy, and you just, we stick with it until we get you where you want to be.
That'd be great.
So that would be the recommendation from my standpoint.
Okay.
And in addition, you should be wearing a support hose. The place that I send patients should fit you, so you are getting a custom fit stocking. Because
Right.
it's important, obviously, that the stocking fit you.
Right.
Otherwise, you're not going to wear it.
Right. Right.
And compliance is a big issue with support hose.
Yep.
So we want patients to wear the
Yeah.
stocking daily.
No, I'm willing to do all of that.
So what are Dr. Smith's plans from here for you?
No real plans right now. He just said that he would never feel comfortable doing, that even if it's a water-assisted liposuction that they do, he was not comfortable with all that I had going on with the
Okay,
veins. So I want to just keep taking the next step.
Okay.
I would love to get that done someday.
I mean, after a microphlebectomy, you have fresh incisions. So those sutures come out in 2 weeks. Other than that, there's really no downtime from my standpoint. The vessel that we're treating with the laser isn't a vessel that Dr. Smith would be doing anything to.
Right.
And after sclerotherapy, there's really no downtime.
Great.
I really refer to them all as procedures as opposed to surgery,
Good.
because we're not in the OR. I'm not making,
I've had enough surgery
you
for a
know,
lifetime
I'm
the
not-
past couple of years. Yeah.
tearing things out of your
Yeah,
body. I mean,
good.
the microphlebectomy does involve removing branch vessels, but it's certainly not the
What
old
would be done
stripping.
first? That or
Laser first.
It's the same day?
laser
First.
first, then I wait a couple weeks
Okay.
and see what happens to this branch vessel. Every now
Okay.
and then, the branch veins will get significantly smaller
Mm-hmm.
after closing the trunk vessel, such that we don't even need to do anything.
Okay.
And then if we can avoid doing a second procedure and making incisions,
Okay,
that's
great.
always preferable.
God, you're great.
I'll have Liz give you a call and we'll choose a date for the
Okay.
laser ablation. And I'll
Great.
talk to Dr. Smith
Okay.
and we'll get the show on the road.
Great. Great.
Okay.
I'm so glad I met you. Thank you
Okay.
so much.
Good. It was nice meeting you
Thank
too.
you. You too. Really. Thank you so much.